Good morning, good afternoon, everybody. How are you all? So, I will not take too much of your time and straight away going to the session was running a little late. Um, okay, all right. So, let us begin, everyone. Okay. So, today you have a class on vaccines and NIS. I've brought a couple of questions. The PDF will be shared after the lecture. Okay, so we have completed EPID, we have completed vaccines. Some of you messaged me that we'll be having sure shot for FMG. Of course, we'll be having sure shot for FMG exams, but that will be towards July. Okay, so right now if you want to revise PSM, you can definitely attend this session also. Okay, chalo, let us begin. So I hope you're done with EPID. Today's vaccines and NIS. Okay. I'm good, thank you so much. This is your first question on the board. True about VVM. Okay, I'll be speeding up a little, guys, because we need to wrap it by 1 to 10, have to rush back for some work. But I will ensure that everything gets into your mind from vaccines and NIS. Okay? True about VVM, guys. Tell me about each of the statement. Does it monitor heat exposure? Does it monitor heat exposure? VVM is one of the, it's one of the golden era question which turns up in every exams. We all know what is VVM. VVM is vaccine while monitor. VVM is vaccine while monitor. Alright, VVM is vaccine vial monitor. So definitely check tells us about heat exposure, whether the vaccine vial has been damaged by heat or not. So of course this is a true statement. Alright, it monitors, what do you say? It monitors heat exposure. Yes, it does monitor heat exposure. It indicates cumulative heat exposure, so it does indicate cumulative heat exposure as well. Does it determine vaccine efficacy? Does it determine vaccine efficacy? No. It is not directly measuring vaccine efficacy. Please remember, it indirectly hints on the factors. It indirectly measures or indirectly hints on efficacy. Indirectly measures efficacy. It does not measure it directly. It indirectly measures. It affects a factor, heat, which is affecting efficacy. Okay? Can be used for expiry calculation? Not at all. It has nothing to do with expiry calculation. Even if the VVM is intact but the expiry date has gone, you will never use the vial. Okay? Expiry date can be changed? No, it cannot be changed. Discard if square is lighter than the circle? No, you will use if square is lighter than the circle. So what is your correct answer over here? 1 and 2. So we'll just quickly revise about VVM. Can anyone in the class tell me, was it outer circle inner square or was it outer square inner circle? So please remember, मैंने बहुत बार क्लास में भी बताया है, दुनिया गोल है, the world is round, right? The world is round, so it is outer circle inner square. And where is the chemical substance present? The chemical substance is present in the inner square. So let us have a look at the image once. Let us have a look at the image. Can you all spot this image? This is one of the most expected MCQ, one or the other way they will give you guys. Outer circle, inner square. If the inner square is lighter, inner square lighter than OC, outer circle, you will use it. If the inner square starts to change color but is still lighter, inner square still lighter, inner square still lighter than outer circle, you will use it. But if inner square is darker than the outer circle, is the same color, the first one is the same color. अगर same color है तो उसको discard करना है, और अगर inner square darker है as outer circle, उसको पक्का से discard करना है. And guys, where is it that you're going to discard? Which color bag? Everybody in the comment section. I'm going to give you a very high yield MCQ over here. Which color bag will you discard? Will you discard in black, yellow, red, whatever color you feel like, white, blue? किस में डिस्कार्ड करोगे, किस में डिस्कार्ड करोगे? रिमेंबर, अभी इसमें वैक्सीन कंटेन्ड है, सो इट इज़ अ माइक्रोबायोलॉजी और बायोटेक्नोलॉजी वेस्ट. नो गाइज, राइट नाउ दीज आर डिस्कार्डेड वाइल्स. Alright, these are discarded vials. They are damaged vials. They contain vaccine. So when they contain vaccine, they are discarded vials. They contain vaccine. You will always discard in a yellow bag. Am I clear? you will discard in a yellow bag. But let me give you a buzz question over here, a high yield point. What is the high yield point over here? अगर एग्जाम में क्वेश्चन आया, if you get in the exam simple question vaccine vial, or you get in the exam broken vaccine vial, all right, just itna likha hua hai vaccine vial or broken vaccine vial, where are these going to go into? These are going to go into the blue color bag. Am I clear? जब कुछ नहीं लिखा है, just vaccine vial, broken vaccine vial, they are glass vials, so they'll go into blue. Otherwise, they're going to go into yellow. Am I clear, everybody? ठीक है? So VVM is done. Also, the chemical is in the square. Now there's one more image I want you to focus on. I think sometime this can come in your exam, whether you're a NEETPG aspirant, FMG aspirant. ये textbook of Park में ये photo है, ठीक है? This image is given in our textbook of Park. Now I'll just zoom this image for all of you. Can you see this image? VVM is there in all the vaccines. Now the VVM could either be on the body, the VVM could either be on the vial of the vial, or it can be on the ampule. So they can give you a question, if the VVM is placed on the body, if the VVM is placed on the vial of the freeze-dried ampule, if it is placed on the ampule or the neck of the vial, which type of vaccine vials are they? Please remember, अच्छे से सुन लो. If the VVM is on the body, guys, body indicates which one? Body indicates the liquid vaccine. Body indicates the liquid vaccines, all right? But if you see it on the cap, I could say this as the cap, or I can say this as the neck of the ampule. If you see them there, what are these two vaccines, guys? These are the freeze-dried vaccines. Now, what is the freeze-dried vaccines? Nothing but they are the lyophilized vaccines, or you could call them as the reconstituted vaccines. You can call them as the lyophilized. You can also call them as the reconstituted vaccine. So they can give you an image where the VVM is in the body, and they can ask you, is this pentavalent or is this OPV? Alright, so something like that. Okay? So remember this extra question. 14 means the days. It resembles the stability in the days. Okay, the numbers. Ravi, you can check out the RR videos on PrepLadder app, where we have explained what is VVM 14, what is VVM 21. It basically represents the days. Now, since the exam is very near, so we can't go into too much detail. Okay, so we are not going to get into that right now. But if you want to understand, go to the RR video on YouTube on PrepLadder app. You will find it. What is the name of this test? Everybody just wanted to revise the name of this test. This is shake test. What does this shake test do? This shake test tests whether the vaccine has been damaged by cold or not. Okay, cold or not. Now what you have to do is, guys, a very simple way of checking shake test is, suppose ये vaccine vial है, ठीक है, इसको shake करेंगे. When you shake it, you suspect that this vial is damaged. In very simple way, I'm telling you, if you shake the vaccine vial, if you see sediments collecting at the bottom, okay, thick sediments, if you see collecting at the bottom, what are those sediments of? This thick sediments, if you see at the bottom, that means the vaccine vial has been damaged. Okay, और हम लोग हमेशा ना इसमें एक टेस्ट वायल लेते हैं, never frozen, ठीक है, frozen and thawed. That means you have a test vial and you have a control vial, and you check for the sedimentation rate. You check for the sedimentation rate. If the sedimentation rate is faster in test vial than control vial, all right, in test vial than control vial, we say that the vaccine vial has been damaged. In case somebody asks you, but इसका chance कम है. एक MCQ यहाँ जो आ सकता है, guys, sediments किस चीज़ का है? These sediments. Now what are the freeze sensitive vaccines? Anybody? What are the freeze sensitive vaccines? Can you tell me the name of couple of freeze sensitive vaccines quickly in the comment section? You all know freeze sensitive vaccines कौन से होते हैं? The T series vaccine, guys, and which is those which have letter T in it. ठीक है, letter T in it. Penta, DPT, TT, TD. All these are freeze sensitive. If anybody asks you which is the most freeze sensitive, guys, in case exam में आ गया सबसे freeze sensitive क्या है? Which is the most freeze sensitive? It is none other than hepatitis B. और हेपेटाइटिस बी गाइस किस तरीके का वैक्सीन है? हेपेटाइटिस बी एवरीबडी इज अ रिकॉम्बिनेंट वैक्सीन, ऑल राइट, एंड दिस हेपेटाइटिस बी वैक्सीन needs an adjuvant to enhance its efficacy. It requires what? An adjuvant to enhance efficacy, and this adjuvant everybody is of aluminium. This adjuvant is of aluminium particles. ठीक है, तो ये जो sediments है ना guys, आ सकता है एग्जाम में, this is aluminium. Remember this extra edge point I've given you. If you are preparing for UPSC also, they can ask you this. Clear? Very good. Some of you wrote it. Very good, Vikas, everybody. ठीक है? And which is the most heat sensitive vaccine? If I ask you, what is the mnemonic for the most heat sensitive vaccine? Mnemonic क्या है most heat sensitive vaccine का? Anybody? What is the mnemonic for the most heat sensitive vaccine? It is R-bomb. R-bomb. R-bomb means the most heat sensitive is reconstituted BCG. Most heat sensitive is reconstituted BCG. फिर OPV, फिर मीजल्स. ठीक है, सबसे ज़्यादा हीट सेंसिटिव जो इजली डैमेज हो जाते हैं इज रिकॉन्स्टिट्यूटेड BCG. वेरी इंपॉर्टेंट स्लाइड ऑफ द डे. शेक टेस्ट किसके लिए? Most freeze sensitive vaccines. Sediments you will look for. What are these sediments of? Aluminium particles. What are the heat sensitive vaccines? R-bomb. Which is the most heat sensitive vaccine? The most heat sensitive vaccine everybody is reconstituted BCG. ठीक है, चलो let's go to the next MCQ of the day. What is stored in the pink zone? Can you identify the pink zone यहाँ पे? What is stored in the pink zone? Just give me 1 second. Just a second. Answer करो इसको. Alright, what is the answer to this? What have you written, everybody? पिंक जोन में क्या है? अब ये किसका इमेज है गाइस? दिस आई हैव मेड द इमेज ऑफ एन ILR. इफ यू सी दीज, नो, इट मीन्स दैट दीज आर MCQs, these are PYQs. So this is a ice line refrigerator. Now what is at the bottom most of an ILR? Basically this pink zone I am trying to ask you this one, all right? So this one is the bottom most of an ILR. Now you all know in the offline class or online class or on prep ladder, we have discussed everywhere that whenever you open an ILR, you open it from the top. So when you open from the top, opened from top, what happens if it is opened from the top? All cold air, ठीक है, सारा cold air goes and settles at the bottom. So if the cold air goes and settles at the bottom, I can't have the freeze sensitive vaccine. What am I going to keep at the bottom? I'm going to keep the heat sensitive vaccines. I'm going to keep the heat sensitive vaccine. And which is the most heat sensitive? Reconstituted BCG. But that's a reconstituted BCG in which you use a diluent, right? You use normal saline. So you can't use it beyond 4 hours. So what is the one? What is next in line, guys? After R-bomb, what is the next in line? It is OPV. So what is at the bottommost of an ILR? What is at the bottommost? It is OPV. What is at the topmost? At the topmost of the ILR में फ्रीज सेंसिटिव वैक्सीन्स है, तो वो कौन से हैं? हेपेटाइटिस बी. और बीच में हार्ट ऑफ ILR, प्लीज रिमेंबर दिस क्वेश्चन कैन कम एकदम इन द मिडल, ऑलराइट, हार्ट ऑफ ILR. व्हाट आर द वैक्सीन्स यू हैव एट हार्ट ऑफ ILR? यू कैन कीप द TT और TD वैक्सीन्स. रिमेंबर दिस, हार्ट ऑफ ILR में क्या रखोगे? बीच में, ऑलराइट. द वैक्सीन्स दैट यू आर गोइंग टू कीप इन द मिडल ऑफ द ILR, हार्ट ऑफ ILR, you will keep the TT or the TD vaccines. ठीक है, let me show you an image of the ILR as well. Look, this is the image of the ILR. You all know cold air goes and settles at the bottom. So at the bottom we have the heat sensitive vaccines, OPV. At the top we have the freeze sensitive vaccines, and in the middle over here what do you have? The TT or TD. All the T series vaccines are above. After OPV you have measles, BCG. ये 3 order याद रखना, OPV, measles, BCG. ठीक है, everyone, placement of vaccines in an ILR, give me a thumbs up if you're going to remember the placement of vaccines in an ILR. I've given you a couple of questions which could come. ठीक है, मान लो एग्जाम में दे गिव यू अ डोमेस्टिक रेफ्रिजरेटर, दे गिव यू अ डोमेस्टिक रेफ्रिजरेटर, व्हाट आर यू गोइंग टू डू? सो जस्ट इसको एक बार देख लो, इट्स नॉट वेरी क्लियर बट आई राइट इट फॉर यू. इन अ डोमेस्टिक रेफ्रिजरेटर, दिस इज द freezer compartment, this is the freezer compartment. In the freezer compartment, of course you can't have freeze sensitive vaccines, you will have the heat sensitive. You can keep OPV in the freezer, but OPV will be kept for long term storage. No, no, not most lower is not BCG बच्चे, most lower over here is OPV. Next in line देखो, R bomb reconstituted BCG is the most heat sensitive, but you can't keep reconstituted BCG, it has to be discarded in 4 hours. What is the next in line? OPV, then measles, then BCG. ठीक है भानु, did you understand? If not, you can ask me again later. Now in the freezer you can keep OPV if you need it for long term storage. You can keep it if you need it for long term storage. In the first shelf, all right, in the up shelf, upper part, uppermost shelf, you have kept BCG, you have kept measles. In the middle shelf you are keeping all the TT and TD. Middle shelf के lower part में you will keep hepatitis B, you will keep hepatitis B. And over here in the lowest shelf, what do you have in the lowest shelf? The diluents. What do you have in the lowest shelf? The diluents. ठीक है, everyone got it? विटामिन ए कहाँ रखते हैं? वेरी गुड क्वेश्चन, सचिन पूछ रहा है विटामिन ए कहाँ रखते हैं. वेयर डू यू प्लेस विटामिन ए गाइज? एनीबडी? इफ आई आस्क यू, वी नीड कोल्ड चेन टेम्परेचर टू कीप विटामिन ए. True or false? Vitamin A bottle need cold chain temperature. Is it true or false? Everybody in the comment section. Vitamin A bottle को maintain करने के लिए we need cold chain temperature. True or false? True or false? I want the answer. True or false? जल्दी बताओ. True or false? Vitamin A bottle no cold chain. You don't need cold chain. You don't need cold chain. It can be kept at room temperature, away from direct sunlight. Away from sunlight. Okay? Away from sunlight. Got it? चलो, so that's the placement of vaccines in a domestic refrigerator. Yellow fever vaccine इंडिया में होता नहीं, so we don't need to keep yellow fever vaccine, although it needs freezing temperatures to store yellow fever vaccine. Got it? Chalo, let's go to the next question everybody. So I'm just going to show you a couple of images. You're going to label it as quickly as possible. This one on the left is the dial thermometer. The dial thermometer is used to monitor temperature of ILR. इसमें minus plus दोनों में reading है. Monitor temperature of ILR. Monitor temperature of ILR. And this is based on the principle of thermocouple. Just revising. The temperature monitoring is done twice per day. Temperature monitoring has to be done twice per day by a medical officer, not in ENM, not a staff nurse, by medical officer. This one right here, everyone, is a stem alcohol thermometer. What is this? This is a stem alcohol thermometer. This can monitor the temperature of ILR and deep freezers. Monitor the temperature of ILR as well as deep freezers. Next in the loop, a couple of images which could come. You all know this is a vaccine carrier. The vaccine carrier, everyone, is lined by 4 ice packs, and it contains 16 to 20 VV. It can maintain the temperature of the vaccines 24 to 48 hours. On an average 36 hours. And this one is a day carrier. This is lined by 2 ice packs, and it can carry how much? How many vaccines? Well, 16 to 20 vaccine carrier can carry. How many vaccine vials can a day carrier carry, everybody? How many vaccine vials can a day carrier carry? Very good. 6 to 8 VV. Same temperature 4 to 48 hours. Or you could on an average say 36 hours. Clear? Chalo, let's go to MCQs now. What is the question of this? Which vaccine should be placed in the whole of the ice pack? Think, you've got an ice pack and I'm asking you, कौन सा वैक्सीन होल ऑफ द आइस पैक पे रख सकते हो. आंसर दो. होल ऑफ द आइस पैक. वेरी गुड. आइस पैक. आइस पैक से जुड़े क्वेश्चंस. व्हाट आर द क्वेश्चंस? आइस पैक में यू कैन गेट अ क्वेश्चन. दे आर प्रिपेयर्ड इन डीप फ्रीजर्स. They are prepared in deep freezers. What is the temperature? -15 to -25. You have a horizontal line over here. Water is filled till that level. Now holes. Ice pack. You will keep heat sensitive or freeze sensitive. You will place the heat sensitive vaccine. So what is the heat sensitive vaccine? Airborne, reconstituted BCG, OPV, measles. So what are you going to place over here? In this hole you could place the oral polio vaccine, not the T series. Even IPV to some extent is freeze sensitive, so we will go for OPV. Clear? और ice pack में water के अलावा कुछ और fill नहीं करना. You will always fill water in an ice pack. Can we move to the next question? Okay. Which vaccine is given as part of NIS to a 10-year-old? Which vaccine is given as a part of NIS to a 10-year-old? What is the answer to this? 10-year-old school going child, national immunization schedule. कौन सा वैक्सीन प्लेस करोगे, दोगे टू अ 10-year-old? वेरी गुड. एक्चुअली डोंट से TT, इट इज TD वैक्सीन. इन NIS it is what? In NIS it is TD vaccine. If you talk about trauma case, it is TT vaccine. Clear? NIS में you always give TD vaccine. TD vaccine is given 10 and 16-year-old. Sara NIS we are going to revise with the help of MCQs only. Okay? So keep following the MCQs. Next one. Guys, do this. I'll just come in a second. बड़े कप में क्या लिखा है क्वेश्चन में? A healthcare worker is preparing for immunization session in a rural community. She has 2 open vials from a previous session, alright. One containing a pentavalent vaccine and the other an MR vaccine. Expiry date has passed in both the vials. What is the correct approach? देखो 2022 में ना there was a question where they did not mention expiry date has passed. They just asked what you will do. So don't introduce bias even if you have read it before. The question there would have been, ठीक है, the question there would have been, if I had not mentioned expiry date, you would have written that we will administer penta and discard MR. But over here expiry date has passed. So if expiry date has passed, आप क्या करोगे? Both the vials should be discarded because expiry date has passed, even if they follow open vial policy. That is why I'm telling you, please read the question. Even if you feel it's a PYQ, you will read the question because maybe the examiner has changed a couple of words here and there. Am I clear, everybody? B answer क्यों नहीं है? B is not the answer because expiry date has passed. Now what was open vial policy? What is open vial policy? What is open vial policy? Reuse of partially opened vials up to how many days? Reuse up to 28 days. Reuse up to 28 days or 4 weeks, provided they are maintained in proper cold chain, expiry date has not passed, the septum is not contaminated, aseptic techniques have been used to withdraw the vials. Okay. Now here the question which is important, vials that follow open vial policy, I'm just quickly revising it, that follow open vial policy. What was the mnemonic, everybody? All the T series vaccine plus PO plus Japanese encephalitis killed. J killed. What is J killed? The Jeev vaccine as well as the Genvac. Genvac uses the Kohler strain. The Jeev also uses SA14-14 too, but in the killed form. And what is T series? All that have the letter T. All have which letter, guys? Letter T in it. So when I say letter T, TT, TD, DPT, Penta, hepatitis. But what is the update? Very good, Dr. Rohit. Everybody great. Hepatitis B, rotavirus, rotavac, the new rotavirus vaccine that follows open vial policy. In old lectures we have stated or we have read also rotavirus nahi follow karta, but ab rotavirus vaccine follow karta hai. And what is this? PCV, what is this? IPV, what is this? OPV. Will you remember which vaccines do not follow open vial policy? So let me just make a slide for you and ask vaccines that do not follow open vial policy. What are the vaccines that do not follow? The reconstituted ones, like BCG में कौन सा diluent होता है? Let's revise that also. Normal saline, sodium chloride. Measles, MR, इसमें कौन सा डाइल्यूएंट होता है? डिस्टिल्ड वाटर, इसमें होता है डिस्टिल्ड वाटर, और यू कुड ऑल्सो कॉल इट एज स्टेराइल वाटर. देन J लाइव, SA 1442, J लाइव, इसमें होता है फॉस्फेट बफर, एंड इफ यू हैव येलो फीवर इसमें होता है कोल्ड saline. So you can use them up to 4 hours. Only you will use this up to 2 hours. You're going to use this up to half an hour. So these are the vaccines that do not follow. For that matter, rabies हो गया, वो भी follow नहीं करता है. ठीक है? Points to be noted. Rotavirus vaccine now follows open vial policy, and J killed also follows open vial policy. But if the expiry date has passed, you will not be using the it will not follow open vial policy. Chalo, let us do this one. Which statement regarding live vaccines is false? 2 live vaccines cannot be administered simultaneously. Booster doses are not required except OPV. Single dose gives lifelong immunity. Live vaccines contain both major and minor antigens. So what is correct? Now, 2 live vaccines cannot be administered. That is incorrect. Two live vaccines can be given simultaneously, but where? At different sites. You will give it at different sites. You can't give it like 9 months mein live JE and measles. We give it at 9 months. Both are live vaccines. JE live is given in the left upper arm and measles rubella is given in the right upper arm. Usually for live vaccines, booster doses are not required. Single dose gives lifelong immunity, again except OPV. So these are all true statements. Live vaccines has both IgG, IgG and IgA. But in killed vaccine, minor antigens destroyed. Now guys, for the gap between 2 live vaccines, देखो or 2 vaccines. Theoretically 3 weeks hai, but practically we tend to keep a gap of 4 weeks. Okay, we tend to keep a gap of 4 weeks. If a gap is needed, we tend to keep it at 4 weeks. Alright, theoretically it is 3, okay, but to make the vaccines effective, we keep a gap of how much? We keep a gap of 4 weeks. Chalo, let's go to the next one. Pentavalent, very very important. PYQ hai, just wanted to revise. Pentavalent vaccine includes which of the following? What is your answer? Penta is a type of combination vaccine. So what are the 5 diseases it is protecting you from? DPT. Diphtheria, it is protecting from diphtheria. It is protecting from pertussis. Is it B? Really? Is it B? It is T is tetanus. उसके बाद और क्या है? Hepatitis B. और क्या है everybody? HIV. So which option is correct? Why are you not marking this correctly, guys? We can't expect to mistaken this one. It is option T. It protects from 5 diseases: diphtheria, pertussis, tetanus, hepatitis B, Haemophilus influenza B. Penta means it's protecting us from how many diseases? 5 diseases. Okay, moving ahead. Which is not a polysaccharide vaccine? So we are trying to revise the classification of vaccines. This was a AIMS PYQ. Just wanted to revise it, to revise the types of vaccines. So which of the following is not a polysaccharide vaccine? Very good. Hepatitis B. Hepatitis B is a recombinant vaccine. Recombinant vaccine. Now what are polysaccharides vaccine? Basically, guys, you have a type of vaccines which are known as subunit vaccine. You have something known as subunit vaccine. Subunit vaccine में we can use the protein part. We can use the protein part of the organisms. इसमें आता है pertussis influenza, protein part of the cell wall, pertussis influenza. All right, pertussis influenza. You can have polysaccharide. You can take polysaccharide. और फिर आप क्या कर सकते हो? Protein and polysaccharide recognized by a T cell. So that is what? Conjugate. Protein and polysaccharide PP को जोड़ दो by a T cell. So that is what? Conjugate. Now what are the vaccines over here? Polysaccharide. Pneumococcal. Pneumococcal polysaccharide. Pneumococcal PPV pneumococcal polysaccharide, PCV pneumococcal conjugate. फिर क्या है? Pneumococcal meningococcals, the coccals family. Meningococcal polysaccharide, meningococcal conjugate. और एक और क्या है? HIV. ठीक है. पॉलीसैक्राइड में देर इज वन मोर एग्जाम्पल, टाइफिम VI, टाइफॉइड का VI, टाइफिम VI. Is it clear? So you should remember this when you talk about subunit vaccines using the polysaccharide component, pneumococcal, meningococcal, HIVs. Conjugate polysaccharide और protein को try to add it, recognized by T cells. So pneumococcals, meningococcals, HIV. Clear? Everybody done? Enjoying the session? Give me a thumbs up. I hope revision अच्छे से हो रहा है. चलो इसमें आंसर दो. सबयूनिट वैक्सीन क्या है? चलो क्या है इसका आंसर? विच ऑफ द फॉलोइंग इज अ सब यूनिट वैक्सीन? विच ऑफ द फॉलोइंग इज अ सब यूनिट वैक्सीन? डीपीटी सब यूनिट है? नहीं. डीपीटी क्या है? कॉम्बिनेशन वैक्सीन है. आईपीवी क्या है? सब यूनिट है? बिल्कुल नहीं. आईपीवी इज अ किल्ड. आई विल रिवाइज द वैक्सीन वंस. बीसीजी क्या है? लाइव. नाउ अनदर सब यूनिट विच कुड कम एज एन एक्सपेक्टेड MCQ, which could come as an expected MCQ is HPV, cervical cancer vaccine. Very soon it will be introduced in an NIS, guys. All right, and this is basically we are talking about Sarvavac, जिसको Government of India will introduce for 9 to 14 years old. And HPV vaccine is prepared using L1 capsid major protein. In case they give you kabhi L1 capsid major protein. All right, so that is again a question that you should remember. Okay, can you tell me, before that question, can you tell me the live vaccines examples? What were the live vaccines के example बताओ, because examples of live and killed vaccines are going to turn up in exam. I love, not chicks, it is chick embryo. I love chick embryo. I से क्या है everybody? Influenza. Influenza, which is given by the nasal root. All right. N over here stands for live. Chicken pox. So for chicken pox you can have OCA, K. This is what? Chicken pox. Or you could also say the zoster vaccine. ठीक है. ई से क्या हो गया? जापानीज एनकेफेलाइटिस लाइव. व्हाट इज जापानीज एनकेफेलाइटिस लाइव? ऐसे 14-14-2. एम से हो गया मीजल्स रुबेला. आर से बी से हो गया BCG. आर से हो गया रोटा वायरस. वाई से येलो फीवर. ओ से हो गया OPV. अनदर वैक्सीन गाइज यू विल रिमेंबर बिकॉज एग्जाम इज वेरी नियर. Hepatitis A. Hepatitis A is available both live and killed form. Hepatitis A is available both live as well as killed form. But we usually use the killed form. But आता live form में भी है. So sorry having a थोड़ा सा आप भी पी सकते हो. You can also have some tea, coffee in between. Okay. All right, hepatitis A. Now tell me the names of some killed vaccines, everybody. Can you quickly identify or give me the names of killed vaccines? You will remember this. KILLED. KILLED. What is K? KFD. KFD में question क्या आता है? Vaccine नहीं आता. KFD में question आता है vector. Anybody in the comment section can tell me the vector of Keysnore-Forest disease. If you remember entomology, the vector of Keysnore-Forest disease. What is the vector for Keysnore-Forest disease? Quick, I want it in the comment section. Good, Alia is the first one to write. You have to tell the complete answer. It is not soft ticks. It is hard ticks. Very good. IPV is injectable polio vaccine. Salk. L is what? Influenza killed. L is influenza killed. E is J killed. Jeevan Chenvat. A for apple, B for ball, C for cat, D for dog. Dog मतलब कौन सा वैक्सीन हो गया? Dog मतलब dog bite में कौन सा वैक्सीन लेंगे guys? Rabies. Please remember, rabies vaccine is a killed vaccine. Good, it's a killed vaccine. We can give it in any and every possible situation because it is a killed vaccine. आप किसी को भी लगा सकते हो. Pregnant female, HIV positive, cancer patient because it has a CFR of 100%. चलो, let's go to this. So types of vaccines का भी revision हो गया. Can you tell me the answer to this? So how many of you are tea person? How many of you are coffee person? Just going out of the books right now. टी पर्सन कॉफ़ी पर्सन, कितने लोग हैं क्लास में टी पर्सन, कितने लोग हैं कॉफ़ी पर्सन, कितने लोग हैं नींबू पानी पर्सन, कितने लोग हैं लस्सी पर्सन, right? Coffee, yeah, even when I take classes I'm always a coffee person, but when I'm at home I'm always a tea person. Chalo, good, whatever you feel like, tea, coffee, just keep revising, keep studying. A 32-year-old person traveled to Africa. He reported fever, followed with chills. Which vaccine, if he had taken before travel, he could have developed the disease. What is this strain? Just wanted to revise a chart on strains of the vaccines, guys. So, this one is what? 17D. 17D is yellow fever vaccine. And if you talk about Geraldine is for mumps. Measles and mumps expected hai. Measles also has a very fancy name to it. It starts with an M, has a fancy name. Edmonston Zagreb. Edmonston Zagreb. G is for J killed. J killed. Oka. Oka is for chicken pox. K, chicken pox. Oka is for chicken pox. Okay. Last time NEETPG पूछा cholera vaccine. Cholera vaccine के strain. Alright, you can get it as mono as well as bivalent. But what are the strains? It is very easy, guys. एक है Ducoral और एक है Sanchol. अब देखो CH cholera आ गया and OL से भी cholera आ गया. Ducoral and Sanchol. Clear? Mostly these are the ones that come in your exams. You can get any of the strains. You should remember a couple of strains that could come. Yellow fever vaccine, vaccination certificate has validity lifelong. And suppose I take I'm traveling to Africa, I take yellow fever vaccine today. So within how many days does the antibody formation starts? Takes almost 6 days. Okay, it doesn't start before that. But validity of vaccination certificate. Validity of vaccination certificate. And yellow fever is a live vaccines. 7 days. Yes, validity of vaccination certificate is lifelong. येलो फीवर का क्वारंटाइन कब है? किसी ने वैक्सीनेशन नहीं लिया. सो व्हाट इज द क्वारंटाइन पीरियड फॉर येलो फीवर वैक्सीन? Quarantine period for yellow fever, I mean if somebody has not taken the vaccine, yellow fever का quarantine period कितना है guys? It is 6 days. Don't say 7, it is 6 days. Okay, and we all know it is a live vaccine. Let's move to the next question. A 28 weeks pregnant woman with a 2-year-old child gives a history of completing required antenatal vaccinations during a previous pregnancy. Which of the following would you recommend for a current pregnancy? Again, pregnancy mein we should know vaccination schedule. I hope it's not disturbing you. Okay? Alright, good. Just wanted to revise. आ सकती है बेनिफिशियरी NIS के कौन है? Who are the beneficiary of NIS? So NIS beneficiary are guys children 0 to 16 years, not 18 years, 0 to 16 years, and pregnant females, So I will say if the woman is a preemie, pregnant for the first time, or she is a multi with last childbirth, कब, last childbirth more than 3 years ago, more than, don't say 5, it is 3, the cutoff is 3, ठीक है. So what are we going to do? We are going to take 2 doses of TD. First, as soon as possible. First dose कब दोगे? As soon as possible in pregnancy. As soon as possible. And when will you give the second dose? The second dose you will give 4 weeks later. The second dose you are going to give 4 weeks later. But in case she is a multi with last childbirth, ठीक है, with last childbirth कब था? Within 3 years. Last childbirth within 3 years. That means her youngest child is less than 3 years old. In that case, you will give a booster of TD. And when will you give a booster of TD vaccine? You will give it around the 7th month of pregnancy. So here she has a 2-year-old child and she is telling you that I have taken all the required antenatal vaccination. So she is falling in this category. Her youngest child is less than 3 years old. So what are you going to do? You're going to give a booster of TD vaccine. Please remember that. ठीक है? You will give. Even if she is unvaccinated and she is coming at term, Gayatri, ठीक है, मान लो लेबर के टाइम आती है, she comes at term, she comes at labor, you will never deny TD vaccine. You will give her a TD vaccine and tell her to take another dose 4 weeks later. But you will tell her that this might not protect the baby and we have to give baby ko, alright, we give the immunoglobulin within 6 hours of birth. That is what we give. But you will never ever deny a pregnant woman TD vaccination. वो किसी भी टाइम है आपको उसको लगाना है. Yes, after 34-36 weeks there are hardly chances that we would be able to, like it might not be beneficial for the baby. ठीक है? Okay, let's revise NIS. What is the answer to this? All vaccines are given at 16 to 24 months except आज मैंने मना किया है, कुछ भी नहीं चढ़ेगा, सिर्फ आज रोटी एंड सब्जी. Nothing would be on the cooker. If at all, then maybe rice that only takes 1 CT. No, 1 or 2 CT. But no rajma, no chola, no chicken, nothing on the cooker. Okay, what is the answer over here? Till our classes go on, nothing on the cooker. No chutney, no mixie. What is the answer over here? All vaccines are given at 16 to 24 months except. Very good. So I'll just quickly revise with you guys. Okay, birth में कितना है? BC, birth में क्या क्या है? BCG, OPV0, hepatitis B. ठीक है? Hepatitis B. Please remember this order: BCG, OPV0, hepatitis B. 6 weeks, 10 weeks, 14 weeks. Okay, 6, 10, 14 weeks. Now what is given in 6, 10, 14 weeks, everybody? You will give OPV1, OPV2, OPV3, रोटावायरस 1, रोटावायरस 2, रोटावायरस 3. उसके बाद पेंटा 1, रोटा पेंटा 2, पेंटा 3. Then what will you give? PCV, conjugate. Polysaccharide 2 साल से below 2 years it's not recognized. PCV1, PCV2, FIPV1, FIPV2. Remember, this is fractional IPV. F means fractional. Fractional means it is what? 1/5 of full dose. 1/5 of full dose is fractional. फिर 9 months में क्या दोगे? You will give MR1, measles, rubella 1. जेई का फर्स्ट डोज. नाउ वी प्रेफर्ड किल जेई. ठीक है, पहले वी वर टॉकिंग अबाउट लाइव जेई, बट इफ यू डोंट हैव किल्ड यू कैन गिव लाइव. आइदर ऑफ द टू कैन बी गिवन. JE1 PCV booster and the third dose fractional IPV third dose. Then 16 to 24 months is basically the second dose of MR2 JE2. And it's a type of booster. The only live vaccines which requires a booster, OPV booster and DPT, because I can't give penta beyond 1 year, so DPT first booster. 5 to 6 years, DPT second booster. And what do you give in 10 and 16 years, guys? TD1 and TD2. TD1 and TD2. And I hope you all remember 9 months may we also give vitamin A. How much vitamin A do we give? 1 ml or 1 lakh international unit. Thereafter every 6 months, every 6 months till 5 years, कितना देना है? 2 ml or 2 lakh international unit. These are all what doses? These are all preventive doses. These are what? Preventive doses, not the treatment doses. ये कौन से doses हैं? Preventive doses. Clear? So यहाँ पूछा था 16 to 24 months. Of course PCV booster नहीं देंगे because PCV booster is given at 9 months. Done? Everybody NIS revision done? Okay. Let's move to the next question. Do it. Again based on NIS. दस महीने का है. Miss the 9-month vaccine visit. According to NIS, which vaccine is not administered at 10 months? So which one I will not administer at 10 months, everybody? He should have taken his vaccines at 9 months. He did not come. So what are the vaccines that you give at 9 months? Think carefully. What are the vaccines that you give at 9 months? We just now did at 9 months, all right, we gave MR1, J1, okay, PCV booster, and we also give fractional IPV ka third dose. Now measles you will give, PCV booster you will give. DPT is not needed to be given. DPT is not given at 9 months. It is given straight away at 16 to 24 months. So of course here at 10 months, if I did not take my baby at 9 months, I took him at 10 months, I don't need to give DPT. Clear? Chalo, I will explain you conjugate, guys. Whatever doubt you have, just note it down. Like yesterday, I will tell you your doubts in last 5 minutes. Okay, we have just a couple of more questions to see. Let me finish those questions, and whatever doubts you have, you note it down. I will tell you. All right, quickly batao. All are correct about ILR except read and answer. Yes, TPT at 16 to 24 months. I have not yet received any answer. चलो एक एक करके ऑप्शन देखते हैं. Keep all vaccines including those returned under OPV in basket supplied with ILR. Yes, you never keep the vaccines directly. You always keep it in the basket which is supplied. कभी भी अगर आप actual देखोगे ना, this time I have uploaded on the Prep Ladder app in the main videos, we have uploaded a visit to Urban Health Center where I have actually shown you ILR and how the vaccines are kept. So in case you have time, you can anytime refer to it. You will never keep the vaccines directly. You will keep it in the basket. Similarly, guys, for vaccine carrier and day carriers, you will never keep the vaccines directly. You always place the vaccine in polythene bags. Place vaccines in polythene bags. Okay, they are placed in polythene bags. Then put in carriers. You never place the vaccines directly. ठीक है. Store diluents +2 to +8 at least 72 hours before use. No, you don't have to place it 72 hours. ये false है. अगर आप diluent को room temperature में रख भी रहे हो, then they should be placed, they should be brought at the same temperature at least 24 hours before use. Obviously, the freeze sensitive, the T series vaccines are at the top of the basket. Arrange vaccines as per expiry date, early expiry ones above, later expiry ones below. So what is the incorrect statement over here? This one. मान लो I don't have space in the ILR or in the domestic refrigerator. I keep the diluents here at room temperature, but 24 hours prior to the session, I need to bring them at the same temperature. Okay, this was just a tricky MCQ. Alright, which vaccine is contraindicated during pregnancy? So what is your answer over here? Which vaccine is contraindicated during pregnancy? Yeah, we have just a couple of more questions to go. 10 more minutes. कौन सा vaccine contraindicated है pregnancy के time? बताओ. The live vaccine. So all you need to do is you need to tell me the live vaccine over here. Very good, varicella. Hepatitis A, I told you both live and killed. Hepatitis A is available both live and killed. So I can use the killed form. Hepatitis B, I know is recombinant. Rabies, I know is killed. So it is varicella. Clear? Okay. Let's see this one. Which is the absolute contraindication to killed vaccines? Have you ever thought about it? Killed vaccine absolute contraindication क्या है? What is the absolute contraindication to killed vaccines? एग एलर्जी में कौन सा वैक्सीन कॉन्ट्राइंडिकेटेड है? येलो फीवर एंड लाइव इन्फ्लुएंजा कॉन्ट्राइंडिकेट. Pregnancy, live vaccine contraindicated. See, they will trick you like this. Individual on corticosteroid, live vaccine contraindicated. Only one is reaction to previous dose, or of course very high fever, disease of unknown origin. It's better to withhold all the vaccines. ठीक है, so just made it out of blue that let me ask what is the contraindication of killed vaccine, which all of you have got it correct. This is a chart, you can go through this later guys. I am running a series on Instagram which is known as the Vital 21 guys. I am giving out 21 days, I'm giving out 21 most important tables, alright. So all these tables are a part of that session, you can go through it. And you can see pregnancy all live vaccine contraindicated except yellow fever. Lactation yellow fever contraindicated. General किसी को fever डायरिया है या बच्चा PEM का है, कोई वैक्सीन contraindicated नहीं है. Asymptomatic HIV positive but no symptoms, none of the vaccine contraindicated. Symptomatic में all live vaccines contraindicated, but to adults you can give varicella. Newborns में now we don't give BCG, so you can cut BCG. Sibling वाला MCQ है, sibling of HIV positive symptomatic child OPV is avoided. ठीक है. Progressive neurological disease DPT vaccine contraindicated due to pertussis component. Epilepsy again DPT vaccine, but epilepsy controlled by anti-epileptics, no vaccine contraindicated. Clear? चलो, you will last, don't worry. Egg allergy, yellow fever, influenza, neomycin आया हुआ है. मीजल्स रुबेला, abdominal सर्जरी, रोटावायरस वैक्सीन. हाई फीवर में तो कोई भी वैक्सीन मत दो. ठीक है. ऑलराइट, गोइंग टू द नेक्स्ट वन. वो पीडीएफ में रहेगा तो यू कैन गो थ्रू इट. क्विकली टेल मी द आंसर टू दिस. यू विल श्री शैल, डोंट वरी, ऑल विल बी गुड. ठीक है. कैन यू टेल मी द आंसर टू दिस? अ पेशेंट हैड रिसेंटली बीन एडमिनिस्टर्ड अ वैक्सीन इन द लेफ्ट आर्म. Post vaccination he is complaining of severe aching pain in shoulder followed by weakness in left arm. Which of the following could be the most common cause? Think. Guys, pain in shoulder following a vaccination. It could be a trauma case also. Very good Lokendra, very good Abhinav, very good Slam book. Gayatri SS. This is a classical case of brachial neuritis, which is a side effect, adverse event following vaccination. ठीक है. Most common side effect with BCG vaccine is ulcer guys. Weakness in the arm, it's reported a couple of days later. It is brachial neuritis. Don't immediately mark BCG vaccine. Okay, what is the answer to this? A child developed persistent inconsolable crying after DPT at 6 weeks. What should be done at 10 weeks? Wanted to revise a thing. Persistent inconsolable crying. Persistent inconsolable crying is no longer an absolute contraindication. You will give DPT vaccine. That is why I gave them. Some of you are still writing to not give DPT. Persistent inconsolable crying is no longer an absolute contraindication to subsequent doses guys. So you will give it. Okay? Now some side effects, you can go through this table later. BCG vaccine का सबसे common side effect ulcer है. Most common side effect is ulcer formation. Scar ना बन के ulcer बन जाएगा. Measles में PYQ रह चुका है, toxic shock syndrome, thrombocytopenia. OPV leads to VAPP because of which switch happened. See, tetanus toxoid brachial, rotavac intersusception, very important. Pertussis screaming, crying, no longer an absolute contraindication, but HHE is. So we'll refer to these two tables, contraindication as was as this one. No, you can give. DPT can be given till 7 years. Just check it once more, Mansoor. I'm sure it will be written. DPT can be given till 7 years. Why will you remove the pertussis component? ठीक है? Okay. चलो इसको question करो. I will be back in 1 minute. क्या लिखा है इसका आंसर? Which of the following is true? Which of the following is true regarding the switch from trivalent to bivalent? ठीक है. सो इसमें क्या है? द स्विच इंक्लूडेड द रिमूवल ऑफ वाइल्ड पोलियोवायरस 1 फ्रॉम द वैक्सीन. इज इट ट्रू? विच कंपोनेंट वाज रिमूव्ड? इट वाज 2. The reason for the switch, everybody, okay, what was the reason for this switch? Let's see. The reason for this switch was eradication of wild poliovirus type 3 in September. No, the reason for this switch was eradication of wild poliovirus 2. Bivalent OPV contains attenuated forms of 1 and 3. This is absolutely correct because type 2 component is removed. IPV was introduced after the switch. No guys, IPV was introduced before the switch. This is a little technical question which you should read and understand. See, this is the photo of switch. This is a NEETPG PYQ. Alright, this is the NEETPG PYQ. We switched from April 2016. एक switch propose किया गया trivalent से bivalent. Now which component have we removed? Type 2. Why have we removed the type 2 guys? Wild poliovirus type 2, the attenuated form, okay, attenuated form that was contained in the vaccine was leading to CVDPV, circulatory vaccine derived poliovirus, which was causing outbreaks. Then WHO said that wild poliovirus type 2 was eradicated. When was it eradicated? It was eradicated long back in September 2015. So why have you still kept it in the attenuated form? Removed. We don't want anybody, child getting paralyzed due to a vaccine. So we removed the type 2. Now wild poliovirus type 3 also got eradicated guys in October 2019, but this causes VAPP, vaccine associated paralytic polio, which is very rare, and this does not cause any outbreaks. Therefore we have still retained it in the vaccine. Whether you have NIS, whether you have pulse polio, everywhere guys the bivalent OPV is being used. Am I clear? And which is the form which is still circulating? Wild poliovirus 1 is still circulating. It is most difficult to eradicate. In Afghanistan, Pakistan, it is still circulating. Most difficult to eradicate. सबसे difficult है इसको eradicate करना, and this is responsible for natural outbreaks. So couple of questions from this slide have helped you revise, okay, which could come as different forms of MCQs. CVDPV is due to which component? VAPP is due to which component? ठीक है, चलो 5 more minutes guys. Last question on delayed immunization, then technical initiatives. What is this? Which vaccination can be given to a 18-month-old child who has never been immunized? 18-month-old child who has never been immunized. Can you answer this? 18-month-old child जो कभी immunized नहीं हुआ है. So this is a question of delayed immunization. Don't go for the option which has the maximum number of vaccines. No. BCG you can give till 1 year. ये तो ऐसे ही गया. Hepatitis B you can give till 1 year. He's 18 months. DPT1, OPV1. I think we can. Okay. All right. But if you look over here, DPT1, OPV1, measles 1, vitamin A1. So which is the one you will go for? B या C? कौन सा आप इसमें मार्क करोगे? B मार्क करोगे या C मार्क करोगे? B मार्क करोगे या C मार्क करोगे? Remember, you can go for C because till 1 year, what are the vaccines that can be given till 1 year? BCG, पेंटा, याद रखना, पेंटा रोटा, बीसीजी, पेंटा रोटा, पीसीवी, आईपीवी, एवरीथिंग इज राइमिंग. बीसीजी, पेंटा रोटा, पीसीवी, आईपीवी. 5 years तक आप दे सकते हो मीजल्स, एमआर, ओपीवी, विटामिन ए. 7 years तक आप दे सकते हो डीपीटी. 15 years तक आप दे सकते हो जे. लाइफ लॉन्ग दे सकते हो टीटीटीडी. इट डजेंट रियली मैटर. सो ओवर हियर वी वुड हैव गॉन विद द ऑप्शन ऑफ ऑप्शन सी. ठीक है, जे एक्सपेक्टेड है. इट कैन बी गिवन अप टू 15 years एज वेल. दिस वन इज ऑल्सो इम्पॉर्टेंट. पेंटा रोटा, पीसीवी, आईपीवी टिल 1 year. What is the answer to this? What does BCG vaccine provide protection against? What does BCG vaccine provide protection against? What does BCG vaccine provide protection against? Quickly tell me. What does BCG vaccine provide protection against? What is the answer to this? Disseminated TB के अलावा extra pulmonary TB, CNS and disseminated, not just B. CNS भी तो, CNS TB also. No protection against pulmonary TB. No protection against pulmonary TB. ठीक है? Alright, now I'm going to show you the last thing, which are a couple of one-liners, guys. So you will tell me the name of technology-based initiatives. Tell me the answer to this. Then I'll show you the image. Monitors vaccine stock, distribution and cold chain logistics. What is the answer to this? Although one-liners will be taken up separately on PrepLadder YouTube on 4th of June. But अगर कोई पूछा monitors vaccine stock, distribution and cold chain logistics, what is the answer to this? Monitors, very good, very good, very good. Monitors vaccine stock. This is electronic vaccine intelligence network. What is this? Tablet based application for ANM. Tablet based application for ANM is Anmol, ANM online. What is this? Monitors and reports adverse events following immunization. This is nothing but SafeVac. This is SafeVac. I'll show you the image of all. Digital immunization registry to track immunization of 0 to 5 years old. This is UWIN. And mobile-based voice message service by Government of India, providing weekly audio messages on maternal and child health, family planning and nutrition. This is which app, guys? This is the Kilkari app. This is the Kilkari app. This is an important, this is very important. This is actually a NEETPG and fmge Vital 21 topic. Alright, this is very, very important. Okay? Now look at the images. I have given you these images. So these are the vital images of the day. This is ANM Online, which is a tablet based application for ANM. This is surveillance and action for events following vaccination for adverse events. This is even electronic vaccine intelligence network. This one is the logo of Kilkari app, guys. And this one is UWIN, 0 to 5 year old. It's like an online immunization card. Do go through these images and one-liners. Okay? Alright. Last but not the least, you all remember this is Mission Indradhanush, protecting you from 12 diseases. However, in Pan India, it protects us from 11 diseases, guys. क्योंकि JE only given in endemic zones, and right now in Mission Indradhanush we are running currently 5.0 phase. Abhiyan Indradhanush bhi I have shown you here so that you don't get confused. The bed sheets in ESI hospital are changed according to the color of the rainbow, so it's a rainbow with the hospital bed. अगर question सिर्फ इतना आया, MI protects from, not Mission Impossible, okay? Mission Indradhanush protects from how many diseases? You will say 12 diseases. Clear? Mission Indradhanush protects from 12 diseases. Alright, so that's it. Let me ask you one more question quickly. Which antigen is present in hepatitis B subunit vaccine? Which antigen is present in hepatitis B subunit vaccine? So you should know it is hepatitis B surface antigen. ओरल रूट से दो वैक्सीन्स जाते हैं गाइज, रोटा एंड ओपीवी. ओपीवी के 2 ड्रॉप्स जाते हैं, रोटा वायरस के 5 ड्रॉप्स जाते हैं. इंट्राडर्मल द डोज इज 0.1 ml. इंट्राडर्मल इज 10 to 15 degree. BCG fractional IPV. BCG, but if you give up to 1 month, it will be given in the 0.05 ml intradermal. After that 0.1. Fractional and BCG India में left arm, left upper arm. Fractional IPV right arm. Subcutaneous remember 45 degree 9 months पे MR and live J. ठीक है, लाइव जे. MR आर से याद रखो, राइट अपर आर्म. लाइव जे लेफ्ट अपर आर्म. रेस्ट ऑल गाइज विल बी IM टी सीरीज वैक्सीन. IM रूट से दोगे 90 डिग्री. Hepatitis B everything, and they will be given on the left leg. But in case they ask you where do you give JE killed, which is now preferred, it is given on left thigh. 0.5. IM में डोज हमेशा 0.5 होता है, सबक्यूटेनियस में डोज हमेशा 0.5 होता है. क्लियर? So that's it for today. Anybody has any questions? Let me just show you. I've tried to revise almost everything for you. FMG aspirants, please don't worry. I will take a sure shot of FMG exam also, which will be based on your PYQs. These sessions are based on NEETPG PYQs, but it is equally important for anybody preparing for any exam. ठीक है? All right. Yes, because देखो fractional IPV right 2 में दे रहे हो, right में दे रहे हो ना, but when you give it at 9 months, all right, MR को आप right upper arm में दे रहे हो, so that time it's given in the legs. ठीक है? Okay, please remember 27th May the test is on demography and contraceptive. One day you are not going to have class, which is on 29th May. There will not be any class. Tomorrow demo contraceptive 8 PM will be the telegram quiz. ठीक है? Delayed immunization table I will just quickly show you. Delayed immunization में you have to remember that, look over here, till 1 year BCG, pentarota, PCV, IPV. It's all rhyming. BCG, pentarota, PCV, IPV. 5 years, measles, MR, OPV, vitamin A. 7 years, DPT. 15 years, J. Lifelong, TTTD. Yes, of course, Gayatri. Let's have faith, है ना? Have faith on yourself. Have faith on your gut feeling. And exams are meant on that, guys. ठीक है? अपने पे भरोसा रखो. Don't panic. Panic से कुछ होता नहीं है. Whether it's whatever exam, and it's just a portion. It's a phase of life. You have things beyond this also in life. Your health is very important. Your parents are very important. So give in your best during this time, and then we will see. Okay, so thank you so much. Yes, FMG students can also watch this, but we will have sure shot FMG in July. Okay, all right. So BCG वैक्सीन पल्मोनरी टीबी से प्रोटेक्ट नहीं करता धनंजय, सारे एक्स्ट्रा पल्मोनरी टीबी से करता है और सीवियर फॉर्म्स ऑफ टीबी से करता है. इसीलिए उस ऑप्शन में लिखा था डिसेमिनेटेड BCG, CNS टीबी, ये सब में वो कर पाएगा. सिर्फ पल्मोनरी टीबी से 0% एफिकेसी है. ठीक है? सब यूनिट मतलब ना लाइव ऑर्गेनिज्म दो ना किल्ड ऑर्गेनिज्म. किसी भी वैक्सीन ऑर्गेनिज्म का कोई पार्ट यूज कर लो. ओके वॉल्कायरे, यू कैन जस्ट यूज अ पार्ट ऑफ द सेल वॉल, लाइक यूज अ प्रोटीन कॉम्पोनेंट, यूज अ पॉलीसैकेराइड कॉम्पोनेंट, देन प्रोटीन पॉलीसैकेराइड जोड़ दो, अटैच इट, recognized by a T cell. When you attach two things by something, it becomes a conjugate vaccine. Clear? Okay, so bye bye. Thank you so much. Telegram quiz will be at 8 PM. I will see you tomorrow. Take care, everybody. Happy studying. Isolation is primary level of prevention. Quarantine and isolation are always primary. We are doing it to protect others. ठीक है?